Dr. Shashi Gujar.
Today, I'm here to talk about a much dreaded word, cancer. Did you know that, just like Patrick just said, 1 in 2 of us will face the diagnosis of cancer sometime in our lifetime? I want you to take the moment to really understand the impact of those numbers. If you're sitting 6 people on your table, 3 of us, if you look around in this room, if there are 300, 150 of us, 50% chance of developing cancer sometime in our lifetime. And what's even scarier is this statistics. 1 in 4 of us will die from cancer. If you thought COVID was a bad thing, look at this number. COVID, since 2020, killed 6 million people in the world. Last year alone, we lost 10 million to cancer worldwide. And unlike COVID, we're going to keep losing 10 million or more each year to cancer. So it's an understatement to really say that we need an urgent innovations for prevention, diagnosis, and treatment of cancers. Fortunately, science is catching up. In latest times, cancer immunotherapy has been identified as the latest advance, the most promising therapeutic options that we have to offer to patients. The sheer impact of cancer immunotherapy has been so much that the 2018 Nobel Prize in Medicine was given to the scientists who discovered the major breakthroughs in the field of cancer immunotherapy. So it's not surprising that the market share for cancer immunotherapy is estimated to be $242 billion by 2026. So what is immunotherapy? In simple terms, immunotherapy is a medical intervention that trains your immune system to fight diseases. And all of us have received a form of immunotherapy sometime during our lifetime. Anybody want to take a guess? Vaccines, absolutely. The concept of immunotherapies date back to 17th century when Edward Jenner really started inoculating people against smallpox. And my apologies, I hope everybody has finished their supper. But this is a most powerful image that I have seen that demonstrates the power of trained immune system and how it can protect us against different threats. I want to talk about cancer immunotherapy by showing this newspaper cutting from 1908 from New York Times. Because when we think about cancer immunotherapy, we think about this is something that is so brand new that we didn't see that coming. Absolutely not true. William Coley, shown on the picture there, he used bacteria to treat cancer in 1908 as the first rudimentary form of cancer immunotherapy. This is actually a really nice story for which he is recognized as the father of cancer immunotherapy. I'm going to tell you that story so that you will get the background on how this really actually came about. William Coley was a brilliant surgeon. He graduated from the med school, and of course, just like any young surgeon, he wanted to treat his patients and get rid of their cancer. But of course, we know that cancer does not just stay in one place, it spreads in your body. So he lost a lot of his patients. However, he was very smart. You're talking about 1908 when there were not many technologies available to give it to patients. He made one peculiar observation. He saw that any time he did surgery on his patients, and if a surgical wound got infected, that patient did better. Okay, so you want to think about this. It is 1908 when you don't even have access to antibiotics. Okay. He figured out that any time his cancer patient who was operated upon got over his infection, his cancer was gone as well. So then what did he do? He created a bacterial soup of his own to inject in cancer patients. And he received phenomenal success even back then. He was way ahead of his time. Couldn't explain how this therapy really worked, and essentially was shut down. Because you can imagine, if you don't have access to antibiotics, if you're injecting patients with bacteria, most likely you're going to lose some of them to bacterial infections. Today, we know that his microbes used to train patients' immune system to fight the disease. I'm going to show you how that actually works out by showing you some of the examples. 100 years fast forward, FDA has now approved the use of live viruses to kill cancer cells. These viruses, known as oncolytic viruses, onco meaning cancer, lytic killing, cancer killing viruses, kill cancer cells selectively without harming normal cells. And just to demonstrate how this technology works, I'm going to show you some of the examples, some of the research that has been done in our lab. What you're looking at here is two different mice. One is non-treated, has a big tumor, and the other one that had a same tumor, but that was treated with the virus. And as you can see, virus eliminates cancer. Here is one example from a melanoma patient that was treated with virus. You can see that after 4 weeks of treatment, melanoma disappears. And here's another example where a person who had head and neck cancer, which was treated with a virus. Both the examples demonstrate that the virus can selectively and very effectively target the cancers in humans as well. But how is it that these viruses really train our immune system? And to demonstrate that, to explain that, I'm going to walk you through one of the simplest experiments that we have done in our lab to really demonstrate how this actually works. So what did we do? We took a mouse and injected that mouse with cancer cells. Of course, that mouse develops cancer. This cancer is then treated with a virus. We use a retrovirus, that is a benign virus that does not cause any disease. And the cancer goes away. But then we did something interesting. We took the immune cells from this retrovirus-treated mouse and transferred into mouse number 2. And we tried to do the same thing that we did in mouse number 1. We tried to give that mouse cancer by injecting cancer cells. But guess what? In mouse number 2, we cannot induce cancer. This demonstrates the power of virus-trained immune cells to provide the protection against cancers. Remember, mouse number 2 did not receive virus. It only received immune cells coming from host that was treated with virus. Right? So that provides the evidence that viruses can train your immune system. But most importantly, what it shows that the immunity that is induced following virus treatment can actually last even after discontinuation of the therapy. And this was the reason why William Coley's patients used to get better, because his bacteria used to train patients' immune system so that they will have protection even after discontinuation of the therapy. Based on these discoveries, currently my lab is developing new viruses and bacteria that can target cancer selectively as a means of cancer immunotherapy. Well, cancer immunotherapy by oncolytic virus is just one example of how we can do cancer immunotherapy. Another example of the cancer immunotherapy drugs that are being developed in our lab include the drugs that can only be activated by selective wavelength of light. Just imagine when somebody receives the chemotherapy, it produces side effects all over your body. But if you have a drug that can only be activated by certain wavelength of light, then that effect just stays in local area. The other thing that we are developing is immune supplements that boost your immune system so that you have protection against various threats in advance. And finally, and most probably this is my most favorite project right now, is that we are one of the first ones to develop a technology by which we can repurpose the immune system response that you have developed against COVID vaccines. So just imagine all of us who received COVID vaccines or were infected with COVID now have an already available cancer immunotherapy approach in our body if you need to use that. That is a fascinating approach that I really love and really love. And I must quickly note that all these research efforts require exhaustive collaboration between local, national, and international partners. COVID vaccine is a great example that demonstrates that when we work together globally, everybody's health benefits. And I'm very proud to say that we are leading one of the most expansive global immunotherapy initiatives right here from Halifax. And I have shown you some of the partners that we have in the United States, in Europe, and in Asia. And I'm very thankful to Dalhousie Medical Research Foundation and Dalhousie for their visionary support of this initiative. And it's my apologies to everybody that today I'm talking very briefly about these different projects. However, this is my open invitation to all of you to come and see us in Dalhousie. Simply reach out to myself or lovely people from Dalhousie Medical Research Foundation to arrange for a meeting, and I'm more than happy to talk with all of you. And I'm going to stop there, but I'm going to leave you with one final number, and that is 0. We talked about different odds and different numbers. We talked about our odds of developing cancer at 1 in 2. We talked about our odds of dying from it in 1 in 4. But let's push for the future where cancer is no longer a dreaded C word. Let's push for a future where we don't have to lose our loved ones to this disease. Let's push for the future where 0 is the number that we use to represent the loved ones that we have lost for this disease. Let's come together and push for 0. Thank you.